Hormonal imbalances is another example. I've had lots of patients, women around menopause, they go through panic a lot of times. So get their hormones balanced. I prescribe bioidentical hormones, and I'm not ashamed to say it. When I do, women feel great, and I get them off of it. You know, it might take 6 months or something, but I wean them off. But at first, I balance them with the hormones because so the ride is not like great, and all of a sudden, they go like this. I pick them up with the hormones, they go, and then wean them off over a period of 6 months. It's much more humane, I think, to do that to ladies, for ladies. Of course, not birth control pills, because that can mess them up. Human bioidentical hormones. I'm a big fan of them, short term. And we have, as naturopaths, we have hopefully the privilege of doing that. We have the privilege in many states, so we should use it. But don't keep them on bioidentical hormones. I don't think it's a good idea forever. Possible remedies are listed. Aconite. Aconite comes up with panic attacks. But remember, my relative, what did I give her? Sepia, because that was her constitution, and her keynotes didn't match aconite. She was still in her constitution. The panic, whatever messed her up, which is dehydration, I believe, hadn't shifted her constitution. She was still a good sepia. Okay, paranoia. We're talking delusions, imaginations, hallucinations. From what I can tell, the sections in the repertoire that relate to paranoia are delusions and imaginations, which are basically equal. Hallucinations. Those are the key words in the repertoire that relate to paranoia. And you can have paranoia in a variety of mental disorders. That by itself is not a diagnosis. Paranoia is a symptom of a mental disorder. So you want to note that. There's paranoia symptoms and syndromes. You want to look at that. Each constitution has its own delusions. There are 200 remedies for delusions. Those are just some sample delusion rubrics. There are delusional themes that Dr. Bakshi talks about. God bless him. I mean, his book is really a gem. I talked to some good homeopaths in Seattle to get that information. Nobody really could help me, even experienced homeopaths. They thought I was crazy to try to even present on this big of a subject. But again, in 6 months I did it. It took a lot of work, and Dr. Bakshi's book, I can't thank him enough. The rubrics that he has in his books are phenomenal. I can't tell you enough about how useful his book was. So this is a delusion rubric of grandeur. I just find that really funny because delusions, God, messengers from God he is. They only have one remedy there, veratrum. But I think many of us homeopaths may fit right in there in that rubric. Because we know what good of a job we do, right, as homeopath. So Liz Laylar, however you say her name, Dr. Laylar, naturopath from, I believe she's from Australia. She has a beautiful book to homeopathic psychiatry. Dr. Philip Bailey's book is homeopathic psychology. This is homeopathic psychiatry. This is the second gem I found in my journey over the last 6 months. I highly recommend it. She says homeopathic psychiatry is a psychoanalytical study of the meaning and application of the delusion rubric in homeopathic case-taking and case analysis. If you're really into psychiatry and you want to do homeopathy, you must have that book. It's phenomenal. She talks about the need for delusions in each and every constitution. So that's the way, you know how Dr. Hersky has got the cycles and segments? Well, she's got this whole thing that looks kind of like that, but it's basically need. It's like each constitution has a need, and this is what they do to meet that need. It's just beautiful. And I agree with this. She says, understanding of the patient's need for the psychological delusion is the indicator of an explanation for the simillimum. The simillimum must have delusion rubrics which match the delusional state of the mind of the patient. So for example, say sulfurs, as we know, sulfurs are arrogant, right? Well, do any of us know why they're arrogant? Not many. I think highly skilled homeopath might know, but most of us may not know why they're arrogant. But she talks about why, in their mind, why are they acting arrogant? They have the need to be arrogant because they have the need to avoid personal responsibility for failure. Now that was enlightening to me, and I'm not sure if I can say, I don't know where Dr. Laylar got all this information. I think she must be a genius. I don't know if she's even right in every single assertion she makes. I don't know, but the book seems beautiful and enlightening. I'm like, really? Is that why they're arrogant? Because they have this need to avoid personal responsibility for failure? I got to refer to Dr. Hersky's notes on that one, see how he views that and why are they arrogant. Sulfurs are arrogant, but this is Dr. Laylar's view on the need behind the arrogance. Just something for you to think about. Like there's a need behind a need behind a need. And so this is the way she psychoanalyzes each constitution. So misdiagnosis of depression. When a patient may be delusional. This is kind of interesting. If a patient is delusional, I've actually seen this once in my practice. The patient was given antidepressants, and she was delusional. So look out for this. If a person with, like my patient with multiple personality, again, was put on what? SSRIs. So he had multiple personality. Some kind of psychotic, nuts, you know, it's like, and then he's put on SSRIs. It just doesn't make sense. So you want to look out for that, and you can catch the mistake that other practitioners, including psychiatrists, might make, because homeopath, hopefully we go deeper. Paranoia, the next subject, possible remedies for paranoia. Again, the Solanaceae family, among these other remedies, Metarhinum and Nux vomica. Let's see, time, oh my gosh, running out of time. So psychosis. Of course, psychosis is typified by schizophrenia. There are different forms of psychosis, dementia, delirium, and major depressive disorder. They can all involve psychosis. So psychosis is a big term, and you could have dementia and psychosis. You could be depressed and have psychosis. You could be delirious and be psychotic. So you want to know about that. Again, this is the sort of thing that is psychiatry talk, and we don't really get that. I didn't get it in school. You have to kind of self-educate yourself. And there is no, the term in the repertoire that equates to psychosis, one of the terms would be insanity. And of course, there's all these other terms, numerous rubrics that may reflect psychosis, such as the delusional rubrics. It's a great chapter of the repertoire, is the delusion section. I think it's highly educational. Again, you want to find the rubric that best fits your case. You want to find what's characteristic and unique, right? So clinical homeopathy is great, but really, obviously, constitutional homeopathy and clinical homeopathy really, I think at their best, they're one and the same. You know, it's like all religions, really, their essence might be the same. It's the same. The clinical homeopathy and constitutional homeopathy, it really is they're one and the same. But you want to go for constitutional, ideally, of course, if you can do that. So find the true constitutional remedy. In this case, if a person is paranoid, you want to find out why is the person paranoid. Figure out how is the paranoia manifesting. Don't just say paranoid. Well, what's paranoid? What's the paranoia about? Like, how are they paranoid? Perhaps it has feelings of guilt. Maybe the paranoia is coming out because they feel like they've killed someone when they haven't. They feel guilty of crime. So that's a delusion they're under. So you look at you've used the rubric, delusions, crime committed. It's a very specific delusional rubric that can capture your patient instead of the patient is psychotic. You know, it's like that's too big of a term to use. So you need to narrow it down. So these are the rubrics that are useful for psychosis, and again, the mind delusion section is beautiful there. Schizophrenia is, again, one of the great, it's the condition you think of when you hear psychosis usually, but of course there are different types of psychosis. That just happens to be one of the main ones. Catatonia, okay, there's some cases that some well-known doctors have shared in their books on schizophrenia. You may want to look at these cases. Notice you don't have to have a fancy remedy like the Solanaceae family of the remedies for schizophrenia. You could have, a patient could be psychotic and need a simple remedy like sepia, right? This is where you really need to be open to all possibilities. So these are just different cases. Okay, next condition is PTSD. This is such a favorite subject of mine to just talk about. I really believe a lot of people have PTSD, they don't know it. 10 years of experience, listening to a lot of patients. I have a full practice every day, all day long, and I see so many people with PTSD, they have never been diagnosed, and they don't even know they have PTSD. And I diagnose it, especially the last 6 months, because I've been reading all these books now, so my antennas are like really much higher now, so I'm looking at people, I'm like, you have PTSD. I mean, as soon as you talk about this particular thing that happened 2 years ago or 10 years ago, you choke up, you cry, I mean, and then as we talk more about it, it looks like they have all this DSM-4 signs and symptoms of the PTSD. So think about the causes of PTSD. It could be from trauma, shock, fright, or grief. So just because a person is anxious, don't think of the anxiety remedies. They could have PTSD. If a person is fears, don't just go to the fear section of the repertoire. Think about maybe that PTSD. You really need to truly understand how to assess these conditions again. There's different types of PTSD. The first type, acute stress disorder, that's really not even a PTSD, because the length of time during which the person suffers from these PTSD signs and symptoms is less than a month, whereas acute PTSD is more than a month, 4 weeks, more than 4 weeks. Then you have delayed onset PTSD and chronic PTSD. According to Dr. Schultz, who's a famous psychiatrist, homeopath, neurologist, he says there's really no drugs for PTSD, and from what I can understand, what I know, there isn't. But he believes psychotherapy works. Therapy works, so you should remember that. But of course, homeopathy works too. So we got homeopathy and psychotherapy to treat PTSD. patients. And we have energy work. I do a lot of tapping and EMDR, EFT on patients with PTSD. Works wonderful. Genus epidemicus is a very, very important subject for you guys to know about. The genus epidemicus comes with acute stress disorder. So let's say there's an earthquake and it puts people in an acute stress disorder, they're traumatized. That doesn't mean they have PTSD. If the length of time during which, again, the symptoms last is less than a month, we're talking acute stress disorder, and an acute stress disorder produces a genus epidemicus type response. So let's say there's an earthquake, God forbid, and 90% of the people might benefit from one remedy. That's what the genus epidemicus is. You don't have to even take cases. Let's say you go to, in Haiti, they had the catastrophe in Haiti. 90% of the people might have needed this remedy X. So that's genus epidemicus. Thank God, during an epidemic, you don't have to be a great homeopath. Just get online on Dr. Herskew's website or my website or somebody you know, and I bet one of us will, hopefully the masters in the country will post it. Like, this is genus epidemicus, just give it out to everybody. And if you don't know any homeopathy, just give it. There's a 90% chance you might get it right. Of course, if you're a skilled physician, homeopathic practitioner, you don't just give it to everybody. You figure out maybe they don't need the genus epidemicus. Possible rubrics are listed here, and these are possible remedies. So I'm just going to fly through the rest. PTSD in children is well worth looking at. They become oppositional. This is something I didn't realize, and I've had a few kids with PTSD. They act oppositional. So when you get an OCD, oppositional defiance disorder, or DD kind of a child, think of possibly the problem may be PTSD, and I've had a few of those. I love Ignatia for that. Ignatia just clears that layer, and then you can go back to the simillimum, whatever it may be. Dr. Schultz talks about the remedy Mancinella for PTSD in children. He loves it, and I honestly don't know a whole lot about that remedy, but it's a resource that you can refer to. PTSD in vets, talk about, again, Ignatia for PTSD. I've had a lot of success with that, so remember that. That's clinical homeopathy. Again, it's not necessarily classical, but it may just be that may be the person's constitution. So just think about that. Using EFT for PTSD, big fan of it. Sleep disorders, trauma. Okay, so sleep disorders is big. You got a little bit of resource there if you need help with treating insomnia. That's a huge subject. Sadly, I can't cover that right now. Trauma, there's different types of trauma. There's individual trauma and there's group trauma. Basically, this is something I got from Dr. Harry van der Zee, medical doctor, homeopath from Netherlands. I love his work. I love his books. He talks about how when you have collective trauma, it causes a miasm. That causes an epidemic, which can cause genetic damage in the individuals, which can cause chronic disease. And he says an epidemic is an expression of a need for collective change, bringing about healing in the collective consciousness. What an insightful view of epidemics. And if you can imagine implementing the above ideas to help use homeopathy to help our clients, we can make it happen. So very optimistic, beautiful view of what's happening on the planet with all these possible epidemics going around. There are all these miscellaneous psychological conditions we don't have time to get into, like jealousy and stubbornness and clinginess and rudeness, which you can tackle with homeopathy. With homeopathy and psychology, I have a lot of slides on that, but I'll just suffice to say one thing about this. You need a team approach to help people with psychiatric problems, especially advanced psychiatric problems. You need the patient, of course, the homeopath, the therapist, and psychiatrist. So it's like a 4-people team approach. And if I were to summarize what's the difference between therapy and homeopathy, which I've had this discussion with a lot of naturopaths, they're like, well, what's the difference? This is, I believe, the difference. That with homeopathy, the remedy is affecting the person's unconscious mind. Whereas with therapy, you're working on the conscious mind and trying to bring to the consciousness what is unconscious. So the therapy attempts to make conscious what is unconscious. Whereas with the remedies, it's just hitting the unconscious directly. So it is phenomenal adjunct with therapy. They work well together. It's much easier to access the unconscious with homeopathy versus just therapy alone. And this is a good humorous thing here that it talks about, see, have you tried turning off your conscious mind there? See, that's therapy, right? In homeopathy, that's not what homeopathy is about. The remedy does the job for you. Goes right to the unconscious level and brings forward all the emotional trauma, brings it up. And then you can do therapy to clean it up. You see how they work together? Okay, so we're going to